I'm Dr. Bowen. I'm a board-certified physiatrist here at New Jersey Regenerative Institute, or NJRI. Last week, I shared the 8 most common knee problems I see in the office. Hopefully this helped you to begin to identify what is causing your pain. Today I'm going to dive into more detail on the most common cause of knee pain that I've seen for the last 30 years, osteoarthritis. I hope you like this video, and if you do, don't forget to subscribe and like, and leave a comment letting us know what you think of our videos and what you want to see in the future. Alright, so let's get into it. The most common knee problem we see here is osteoarthritis, or just arthritis. This refers to the wear and tear and eventual breakdown of the articular cartilage that covers the ends of the bones. So how would you know that you actually have arthritis? Well, most commonly you'll have general achy discomfort or pain in the knee. Secondarily, you may feel stiffness that's usually worse in the morning or after prolonged rest. And third, the knee may feel swollen or full. So when you come in for an evaluation to determine your knee symptoms source, whether it's from arthritis or something else, I'll review your complaints, conduct a thorough physical examination, and typically I might follow up with an X-ray or MRI. However, if there's a concern for something different as your cause of the pain, or additional testing may be recommended. Most of the time, imaging is only beneficial to make sure there's nothing else that explains your symptoms, such as a fracture or tumor. Okay now, so how do we treat arthritis at NJRI, and how does that differ from some other places? So we see a lot of knee complaints as specialists. People are often seen by other more general healthcare providers first. So many of our patients have already seen various providers, given various treatments, having different diagnoses, and given options. And they're looking for something different, and often less invasive, which is why they come to see us. For arthritis, there are multiple treatment options that you can start with. First, things like physical modalities, such as ice, heat, sleeves or knee braces, alternate footwear, shoe wedges or orthotics, exercise for strength, flexibility, and weight loss, and chiropractic or physical therapy. These things change your mechanics and reduce the force across the joint. There are also some other options for simply treating the pain that would include electrical stimulation of various forms or even red light therapy. Medicinally, you can also treat with supplements such as curcumin, boswellia, or bromelain, as well as glucosamine and chondroitin. These can all be taken by mouth, or you can use topicals like CBD or methadol rubs, such as Bengay. We have a few things in the office that we sell, such as CBMD and even Zymogen supplements. You can purchase these at our office or online at Amazon. With arthritis, it's also important to examine your diet. Treats high in sugar lead to inflammation and can increase arthritic pain. I recommend a low-inflammatory diet to all of my arthritic patients. The diet largely avoids sugar, dairy, soy, and gluten. So try excluding some of these foods from your diet. It won't cost you anything, and it may give you some significant relief. Another easy fix is over-the-counter medications like Tylenol, or Advil, Motrin, Naproxen, Aleve. While these are good in the cases of flare-ups, long-term use is not optimal and is discouraged. Pharmaceuticals prescribed by a physician could include higher-dose anti-inflammatories like Motrin and Aleve, and they also include other options like Cymbalta or opiates and narcotics. Again, long-term use of these is not advised. For more long-term relief, medications can be injected. Most people have heard of steroids or cortisone, and these injections can be performed, but they can also increase your blood pressure, increase your blood sugar, and the benefits are usually transient. Viscosupplementation, also known as gel shots, chicken shots, new oil in the joint, or lubricating injections are also commonly used. They're usually given in a series of 3 and provide about 6 months of benefit. Alternatives can also include acupuncture, with usually a trial of 4 to 6 sessions. And if beneficial, you can do maintenance treatments with little downside. The more conservative treatments do not provide adequate pain control than your desired function, then there are more invasive treatment options. A more aggressive option are nerve blocks. Recently, injections to block the nerves around the knee have been tried. These are called geniculate nerve blocks. If you respond well to this treatment, the nerve can be burned for more prolonged relief of pain. This sounds like it should really be reserved for a last option, but it's there if you can't have surgery or if you continue to suffer from persistent knee pain despite the knee replacement. Another more aggressive option is a knee clean-out or debridement surgery. However, there's very little science supporting its benefit, and improvement is only transient at best. Physical therapy seems to show the same benefits as this treatment, so we don't really recommend this as an option. Ultimately, a total knee replacement with metal and plastic is commonly performed on those with advanced arthritis. This is the most aggressive option available for knee arthritis. While this may be the only option if you have pain that is extremely severe and your function and quality of life is unbearably limited. Most times though, you don't have to have a knee replacement. Most of my patients come in wanting to avoid a total knee replacement. So for these patients, I recommend PRP or MFAT procedures, depending on the severity of their arthritis. You may have heard of the term PRP, which stands for platelet-rich plasma. This can be used for mild arthritis, and the duration normally lasts approximately a year. Occasionally, some people have much longer duration of effect. Options for more advanced knee degeneration include injections from cellular sources, such as bone marrow or fat. Both the bone marrow and the fat are processed and then delivered to the desired location or locations with guidance such as ultrasound and or X-ray called fluoroscopy. In the United States, we're generally limited to autologous products. This means that the source of the treatment comes from the same individual being treated. So what we use to treat you comes from you and goes back to you. So that stays within these guidelines. In addition to the injections, shockwave is used. This treatment provides acoustic energy to stimulate healing and can be an adjunct treatment for addressing cartilage. Some physicians perform injection procedures in isolation, but we want to maximize your potential for complete healing. So we also include adjunct treatments such as nutritional recommendations, weight loss counseling, prolozone, shockwave, peptides, and specific movement evaluations called functional movement screens. Here at NJRI, we do whatever it takes to get you back into doing the things you love. Our goal overall is to unlock your intrinsic ability to heal. That's all I have for today. Thanks everybody for listening and continue to support us. If you like what you saw today, you know what you can do. Hit that like button. It costs you nothing and it helps us. Also subscribe, click the bell notification so you will not miss any of our upcoming information. You can also find us on our website, TikTok, Facebook, Instagram, and X, all of which are in our link tree on our channel homepage and pinned in the comments below. Feel free to leave a comment below letting us know what you'd like to hear more about. Thanks for watching.